The title given to me was a classical understanding of osteoarthritis in Ayurveda. The first part of the title, which represent a particular time, which is at least more than 1000 years back. And the last part of this title also, Ayurveda, which also have a history of time, at least not less than 5,000 years. And the middle part, unfortunately, have not much to say, because the osteoarthritis, the terminology, which never fixing the time space between these two lines. So I was a little bit confused. Probably the organizers expected to me to speak on Sandhigata Vata or Sandhivada, which commonly to be correlated in terms of osteoarthritis, which may not be so accurate in most of the time. Anyhow, I like to bring your attention to the classical understanding of anything when we study in Ayurveda. Many times this picture is very commonly been taught from childhood about a 5 blind person looking at an elephant. And many times we face this also in Ayurveda. So Ayurveda been evaluated by different medical system, including the Department of Ayush. There are different people are looking into one medical system from their own evolutionary perspective, and not necessary to be equivalent just because of the reason that the evolution of thought itself is completely very different from rest of the other systems in the department. So this picture also give another image to us how 5 sense organs are and what is the perception of reality through different sense organs, which is also very relevant to Ayurveda. And it is also important to have this picture because Ayurveda been explored in different countries under some of the such fascinating aspects. Just like in the picture you see a herbal medicine, a part of a tree, a part of a plant in the front of an elephant. So in picture for Ayurveda it means a lot. The giganticity of the Ayurveda in one side, the poor limitation of perception of reality of a human being in the other side, which makes a great sense when I speak on osteoarthritis. What make me to say this sentence because so far Ayurveda is concerned, the evolution of anything will become a prime important to its own system, because by that only it evolves everything, and by that only it applies and utilizes and communicate to the people. One of the best example is about how our textbooks are. If I say from a Charaka Samhita to a Vagbhata Samhita, just like my title is the classical understanding, if you look into the whole Samhitas from Charaka to the later Samhitas, these books are not only merely a compilation of something, it is also a landmark of theoretical evolution. It is also a landmark of the updated knowledge of that time, and it is also shows so many undercurrents of science in the textbook. If you just look into Charaka Samhita, it is beautifully understandable that the evolution of Vata dosha is very clear. If you look into Sushruta Samhita, there is an evolution of Pitta dosha there. If you look into Vagbhata Samhitas, there are evolution of Kapha doshas there. There are also many undercurrents which never come into the topper level of the evolution. Like there are many concepts like subdosha materials, like as Sushruta trying to put about the Rakta as a subdosha in a different status. And just like Vagbhata also trying to put a status of Tabdosha to Ama, which is very clinically been very significant. So our evolution through Samhitas are very much significant, at least for ourselves, because that is the methodology by which we evolved at this juncture, and we are evolving in further also through our own Samhitas. So let me take you to a small travel to our own classical Samhitas with little informations about Sandigavadam, etc. From Vedic period onwards, we have a lot of information regarding a Vadavyati. It may be from the earliest books books like Rigvedas and all, Vajjanaste Bhujastambam Punastabhyam Samahrada, that type of Ashwini Devas management to many of the joint related diseases are very well explained. But even though it is not explained in which way they have done these type of manipulations. There is also a detailed description in different contexts about Vada dosha, Vada as a dosha, in many of the Vedic textbooks and later on to Upanishads, etc. Let me directly jump into our own Samhita, the great Charaka Samhita, where the Sandigata Vada is described, but unfortunately there is no much details about its etiopathogenesis independently. This is another tough area we fail to understand our own textbooks. When a student studying in an Ayurvedic college, when they start studying an anatomy, he finds very difficult to get proper information of many of the anatomical materials in our own textbooks. It was not the student's mistake, neither the teacher's mistake. It was the mistake of how we understand our own Samhita. For example, if you look into Sushruta Samhitas and Samhitas, there is no much description about pancreas, or there is no much description about many of the thyroid and many other organs. And how a Sushruta, a person who can speak about the layers of skin like Avbhasini, Lohita, Shveda, just 1/18 of free size, how can he miss such a thing? Because the reason behind is that our own Acharya has their own vision of looking into a body. The very Sharirasthana starts with funnily, we starts with the Garbha, and in our anatomical lab, we start with the dead body. We starting with Shava, and on the Shava, we'll start things. But our own Samhita starts with the life, and we start with the death in our own clinical, in our own anatomical school. So, we'll go in wrong direction, create such type of misperception. This creates lot of problem. When you look into our own textbook, the order of evolution of anything is from karma to guna to dravya. So a cell has been given an order that tomorrow you are going to become the heart of somebody's body. This message has been given by Atman, and that cell perceives that karma from the Atman or whatever it may be, and later on those karmas, to perform those karma, that cell or whatever it may be, that cell will collect sufficient gunas, and those cells, when it multiplies, then it forms into a tubular form, then what we study in embryology, then they become coarcated, at last they become a dravya like a heart. So where comes the heart? So it comes from as one cell to a thing. So in Ayurvedic evolutionary way of understanding, it is started from a karma, then followed by guna, then followed to a material organ. Because of this reason itself, most of the time we may not be able to find many of the things what currently we look into, what we currently expected from the textbook. It was not their mistake, it was our mistake to understand our own Samhita the way what they were evolved. This makes a great sense if we look into different descriptions disordered with sandhis. The previous speaker today here elaborately spoken about wide varieties of rheumatic diseases, wide varieties of infective, inflammatory, degenerative, a wide variety of diseases, and we may find very confused that probably we may lack such things, but not really so. Even just only in the Charaka Samhita itself, I just enlisted few of the things. A large number of clinical presentations related with the joint are directly or indirectly explained. This is just a small example to give you a good idea how our Samhitas work. And coming back to Sushuddha, so the Sandhigata Vadam is told in the first chapter of Vadavyadi Nidanasthana itself. And there is a detailed explanation of what a Sandhi is and how this Sandhi Bandha Mokshana is happening. Just like in a Pakshagada, Kalaya Ganja, Bhagna, etc. Coming back to later Samhidas like Harita Samhita and Ashtanga Sangra and Ashtanga Hridaya, they were directly speaking about the problems of Sandhi. But when you look into Charaka Samhita, the third or fourth shloka of Charaka Samhita Chikitsastanam was very significant. Because he says that there are three types of Vada pathology can occur. One is Vyahada Gadi, second one is Asthanastha, third one is Vigridim Gada. The shloka is opposite. Avyahada Gadi, Sthanastha, Pragridim Gada. If these three are in normal, if there is no Avyahada Gadi, means there is no Vyahada Gadi. Sthanastha, if doshas, Vada is in its own sthana, and Apragupita. If it is not Pragupita, so always Vada in balance. But all the three manifest into three separate pathological manifestation. The Avyahada Gadi creates an avarana like of pathological entity, and Sthanastha will change into Anyasthanastha, create different type of Gadavadas like Pakvasya Gadavada, Amasya Gadavadam, including Sandhi Gadavadam. And Pragridim Gada changes into Vigridim Gada, change into different type of dosha manifestations in terms of Dhadukshaya and so on. So, the very moment when Charaka trying to explain the abnormalities of Vata, he was very clear about the pathogenesis or the type of Abhyandara Vigridi, which Chakrabani says, Abhyandara Vigridi Parambara eva Vyadhi. Vyadhi itself is an Abhyandara Vigridi Parambara. But such type of descriptions never comes to Ashtanga Hridaya or Ashtanga Sangraha. Rather, they were very keen about the pathological problems that a joint can happen, and they are keen about the symptomatology, and they were also more looking into the management of it. But when you come into Madhonidana Gadas and all, the evolution of joint disorders, the multiplicity of joint disorders or classification of joint disorders become much more complex in terms of different things. A good example comes later by Siddhanta Nidanakara, Siddhanta Nidana book by Gananath Sen. So Chakradatta, I'll come to that. Chakradatta was another person who given an elaborate detail about Sandhigata Vata in his Vada Vyadhi Chikitsa, and as well as in Bhava Prakasha, there is a wonderful explanation. Presently, as I told in the beginning of my talk, presently these rheumatic and osteoarthritis, rheumatoid arthritis and osteoarthritis being classified, and most of this classification look very similar if you look into some of our textbook like Siddhanta Nidana of Gananath Sen. He probably at his time the descriptions of joint disorders become much popular, either may be made by himself or any of his teachers or ancestors were made a sufficient collection of classification of joint disorders into Rasavadam, Jirnavadam, Jaravadam, etc., like that. Sarvesha, he explained in a very independent way based on that avayava. Normally, that type of descriptions are comparatively less in our own Samhita because we follow most of the time the physiological activity of manifestation, not the anatomical structural manifestations. So far the Vada Vyadhi is concerned, the site and Vada Sthana are very well easy to be understood. So I like to highlight one thing about the status of Avarana regarding the Vada Vyadhi. Most of the time, this Avarana is normally being understood as very complicated aspect of a dosha, which is covered by another dosha, making some acute manifestation, not necessary to be so. A good example is Kaphavrata Vyana, like a symptoms. When you look into, many times people will try to correlate this into a Parkinson's disease or etc. something else. But the symptomatology is also closely related with osteoarthritis and rheumatoid arthritis too. So, Guruda Sarvagatranam Sarvasadhyasya Vyane Kaphavrade Lingam Gadisanka, which is previous speaker has told about the Gadisanka etc. So, many of the Avarana can be also be taken in a different clinical condition to understand what type of management to be done. Most of the time, the Avarana may not necessary to be a disease, and Avarana is not a disease, it is a pathological process happening inside a person's body, and this is a part of a Samprapti, and the purpose of knowing this Avarana could be that it needs a special attention while handling the disease. So, when you look into a Sandhi from an Ayurvedic perspective, there are many materials in a structural way we borrow if we look into from Ayurvedic perspective, like Asti, Mamsa, Rakta, Upadhadus like Tok, Snayu, Kandara, Sira, etc. And among the doshas, Vyanavayu and Kleshaka Kapha, later things. And so far the Nidana is concerned, osteoarthritis or Sandhigatavadam has no specific Nidana is not mentioned in the classical book. Rather, we can take the same common Nidanas generally told for Vada Vyadhi. Normally, it may be an Aharaja Nidana or a Viharaja Nidana, and there may be a very specific Vishesha Nidana to the given conditions. Acharya Sushruta was trying to elicit certain etiological factors which is responsible for Vada Vyadhi. Probably when the next speaker may speak about different treatment, it is very significant to see there is a gross difference from a Charaka to a Sushruta in looking at the management of joint disorders. A good example is when you look into Sushruta Samhita, he was telling about using of Vardhamana Pipali in these type of problems, which was not at all seen in Charaka, which was also very practically we have tried in many patients also, shown very good result. So, it is very interesting to see how different Samhitakaras visualize, probably the reason that at the time what they experienced, what are their clinical experience, what they found in their practice may be added or made them to develop that type of attitude to understanding that problem. The typical features of a Sandhigatavadam is very well known to all of you. I doesn't need to explain one by one or word by word. Most of the BAMS student will study this Sandhigatavada by heart, because most of the time when we are examiners, most of the students will like to have a patient to guest and Sandhigatavada or Girdrasi, Kadigraham, this type of thing, because they are said to be very simple. If they find some Bakshagada or some other little bit complicated cases, so they will say, no, sir, I will take Sandhigatavada case because it's very easy to explain in the bedside. So, being a teacher in the school, in Ayurvedic college, most of the time, Sandhigatavada is most commonly being faced, and most of the BAMS students will enjoy to evaluating a Sandhigatavadam, but it's not look very simple, really. Because there are a lot of confusions and there is a lot of poor clarity in understanding this. First of all, the Purva Rupa of the sun. In our textbook, there is no direct description about how Sandhigata Vada can occur. But of course, the next speaker may be speaking about, while they are speaking about the treatment, she may be going to explain few of the things. But Avyakta Lakshanam Desham Purvarupam Idismadam, like the gradual onset of a manifestation can also be taken in most of the Vada Vyathis. But this has to be evaluated later, because so far Vata is concerned, the gradual onset, is it happen so, is a question. Vada, the nature of Vada itself is most of the time Ashukari, and if there is an onset in a gradual, how can it happen except in Dhadukshaya manifestations? So, coming to the clinical features, the Handi Sandhi Gada Sandhin, Shula Shopa Karodicha, the pain, swelling, like which is very common explanation what we get, is directly related with Vata, and most of the time there is an association of slightly Kapha, sometimes slightly Pitta. If it is association with Pitta, it is said to be more easier. If it is associated with Kapha, it could be more tough in both the level, in evolutionary level too, and as well as other sense also. Because any disease that normally expected to follow the rule of Kapha to Pitta to Vata. A mango will be an unripened one, gradually become ripened, and it get dried back into a black thing. So, just like a Kaphavastha of in the beginning, then become the Pakvavastha of a Pitta dominant stage and the last a Vada dominant stage. So, every disease expected to follow a Kapha followed by Pitta and Vata. The time difference between one to another may be vary. In some, it may be almost negligence. But whenever there is a combination of Vada and Kapha, there will be always challenging. As we all know very well, like a psoriasis, like a bronchial asthma. Whenever there is a combination of Vata Kapha, it is always a challenging. And the clinical symptoms like Vada Purna Dudisparsham, very well known to all of us. I don't deal about this. I like to speak something else more detailedly. So, when we look into later textbooks like Madhavagaras and all, they try to evolve and they try to classify the joint disorders into more than one heading, taken out from the Vadavyadi chapter into Amavata. And when you look into later Samhitas, like as I mentioned, Gananath Sen, he classified into further into many more. So what it makes sense that in which background we diagnosing or naming a disease is very important. And rheumatoid arthritis patient, if you are diagnosed from a Vagbhara point of view, your diagnosis may end with Vadarakta. The same patient with the same manifestation, if you look from a Mathaunidhanakara's domain, this will become an Amavata. So, many times this was a quite argument area between South India and North India. Here people will say Vadaraktam, they have Raktavadam, the other side they will say. There are independent description of Raktavada itself. So, this type of controversy happens because unfortunately many times we forget about the scaling of our time and in which scale, which plane of the time what we are speaking of, in which context we are speaking of. So, any diagnostic plane, so far Ayurveda is concerned, the time period is very important. If we are speaking from a Charaka Samhita point of view, an abdominal pain of a patient may be looked from a Gulma chapter, which may be completely different from Madhav Nidhanakara's plane, which maybe comes into a Parinama Shula or Shula chapters. It doesn't mean that clinical conditions, Shula, Parinama Shula, were not seen by Charaka, rather he included under the Gulma. So, it is very significant for Ayurveda at least that whenever we come into a diagnostic, if at all it necessary, on what time period we are speaking of. If we want to take a terminology from a textbook, otherwise it's okay. So Acharya Charaka trying to explain osteoarthritis or Sandhigatavadam, creating the Sankocha, Parvanam Stamba and Asti Parvabheda, and Samprapti, there was no independent Samprapti has been mentioned for Sandhigatavadam, because the very word itself is the explanation of the Samprapti of the disease itself. As Anyasthanasthana is the way of a dosha travels from its own sthana to Anyasthana. That itself is a part of a Samprapti. Hence there was no need of explaining a Samprapti independently. Vehe Shodam Siriktani. This is a generalized Samprapti what we get in the textbook. Differential diagnosis is something very important. So far Ayurveda is concerned also. So most of the time in clinical practice, especially from classical understanding related with the Sandhi, I am speaking from classical textbook because that was my title is. So I am speaking about Charaka Shushada and Vagbhada spirit, not below at least. So Amavata, Koshtuvashesha, Vatarakta, Urustamba, these type of things are quite commonly related with joint and joint disorders. So it is very easy to differentiate between an Amavata to a Sandhigatavatam of many reasons. The funniest thing is that the very definition of Ama itself created a lot of controversy among understanding the textbook. The commonest shloka of Ama, Ushnalpa Belatvena Dhadumadim Abhajidam of Vagbhada, is not at all his opinion. It is not Vagbhada's opinion. It was earlier scholar's opinion. He borrowed from earlier scholar and he had his own opinion in the next line. Anye doshe bevadyur dustenyanyopi murchanat kodrivesyo vishasyeva vadandhyamasya samava. That is Vagbhada's opinion. The previous shloka of Ushmalpa Belatvena Dhadumadim Abhajidam, which is closely related with the concept of Ama of Charaka, he completely denies, which has been very clearly been understood if you study from the Anumata Tantrayukti basis. Unfortunately, there is no Anumata Tantrayukti is not explained directly in Ashtanga Hridaya, but if you go through the Arunadatta commentary, you get the example of Anumata Tantrayukti in which he doesn't quote this example, he quotes some other example, like explaining about the 9th chapter of Vidya context, and he explains that there are different type of Vidyas and in that way. So what I mean to say is that Vagbhada was not a person who follows the previous scholar's opinion, at least in terms of Vidya, in terms of Ama concept and all. That is why when you look into the Samprapti of Jara, Amashayam Pravishya Amam Anugamya Pithaya Cha Shodamsi in the Jara Nidana of Ashtanga Hridaya. So the school of Vagbhada was very clear and he was very clear to deny many of the things of previous authors. He was saying in the Jara Samprapti that Amashayam Pravishya Pithaya so Anugamya Amashayam Pravishya in that sentence Anugamya cha Pithaya Shodamsi. Anugamana to happen in Anugamana, that should have Ama could have happened something else, not in the Koshta. So it was very clear from Vagbhada's point of view what he meant for Ama in his textbook. But most of the time we wrongly quote the shlokas according to Vagbhada, Ushmano Alpa Belatvena, the common shlokas. These another, most of the time mistake happens because of the scaling of Samhidas and understanding of Samhidas in time to time. So anyhow, so for the clinical condition is concerned, differentiating between an Amavada to a Sandhivada is very easy. Based on the Nidana, how the manifestation of dosha is, the nature of dosha is very clear. This is another reason why Vagbhada placed Ama in the chapter of dosha Bakramaniyam. If this Ushmanalpa Belatvena Dhadu Madhyam Abhajidam like a content, Vagbhada is not a injudicious person, he is not an injudicious person to place things in wrong place. He could have told that shloka in the Matra Shidiyam while explaining Vishujika, Alasaja, etc., which is very similar to this condition. He was very clever enough to put that content in the chapter of Dosha Bakramaniyam, where he trying to project himself that Ama could be placed into a subdosha status, which is we all of them agree with that. Because in most of the time in clinical practice, beside the dosha, one of the commonest thing we want to analyze is the status of Ama. That's why many times we use the term also Amadosham, many times. Subdosha status. There is another reason why that is placed in Dosha Vakramaniya chapter. Because beyond the dosha, there are something else to be also taken into credit for evaluation. So that itself is, so far Amavada is concerned, the causative factors, the aggravation of Ama is very clear. How it has been evolved into detail like Amavada disease, which is very clearly been told by Madhanidhanakara in a better way, with a good example of how Ama is converting into changing in from the Koshna and how it's traveled into that. These are the just a translation of the same Madhanidhanakara's versions. Viruddhahara Jeshtasya Mandagne Nishchalasya Snigdam Muktaudahinnam Yayamam Kurdostada, that shloka. So, the Ama dosha, I like to name Ama as a dosha, at least for Sandhi Vyadhis it's concerned. Because this makes very sense, because Sandhi is basically a Kapasthana along with Vadasthana. So, there are possibility, one of the major possibility of getting disturbances is Kapha, and that type of abnormal kapha dosha, which may or look very similar to Ama status. So, Amadosha can cause many other diseases also, just like Amavata. So, it can be very easily been understandable by Stabdada, Tivrada, Jwara, etc., like symptomatologies, which is very well known to all of you. And these type of Amanubandha symptoms are never been told by any our own acharyas, and even in the presence of Avarana in Sandhi, which is a Sandhigata Vada, the presence of Ama is almost negligible, and that's why the Samhidakara is trying to explain the treatment of Vada Vyadhi as Kevalam Nirubhastambha Vado Snehe Rupachari. So create any associated doshavastha into Kevala Vatavastha, Kevalam Nirubhastambha, then you start with Jnana. So in clinical practice, that's why we don't know whether there is a Amavastha is or not. The degree of Amavastha is not able to measurable. Still, we could able to make little Rukshana or little Deepana Pajana, so that we are making that situation into Kevalam Nirubhastambha, and so that we can able to handle the situation with Snehi. So another clinical conditions like Koshtuka Shirshams, etc. are also been there. One more thing I would like to highlight, because the previous speakers also told about avascular necrosis. Some of our descriptions of Urustambha looks very similar to avascular necrosis, and many of the Ayurvedic speakers, current day speakers like Dr. L. Mahadevan, Dr. Gopakumar, there are many of the speakers also quoted some of the references of Urustambha correlated with avascular necrosis. But anyhow, the management is completely different so far our concept is concerned, because it is Panchakarma Asadhya situations. But it is very easily be differentiated from osteoarthritis condition. Vadarakta, this is another thing. Here we have to be very careful, because if we are speaking about Vadarakta, whether it is you are speaking about Vadarakta of Sushruta or whether you are speaking about Vadarakta of Charaka, or we are speaking about Vadarakta of Vagbada, there are a lot of variations between. Slight variation between. Depends upon their clinical presentation, what they have seen. So, if we are taking a rheumatoid arthritis condition from a Samhita period, like Vagbada's observation, there are very close relation with Vadarakta. But when it comes to later books, it is not. So, we have to be very careful, what does it mean? That's why I put Vadarakta is mainly disease of joints. Many of you may not be agree with me. Because nowadays many of the peripheral vascular diseases are commonly correlated with Vadarakta. So, why? Because when we take some of the sampraptis of these diseases, this looks very similar. So, I strongly believe that in our textbooks, each disease, under the name of each disease, what has been described, has another way of agenda. One of the agenda for our Samhitakaras is to look directly into that area. A patient comes with abdominal pain, probably Acharyas expected that we'll open the chapter of Gulma. A patient comes with an increased body temperature, we are expected to open the chapter of Jara. So like that, a patient comes with some articulopathy, some rheumatic or arthritis related things, in which we are expected to open the chapter of Vadarakta. That is one way of looking at the Samhita. Another way is that there is a peculiar scheme of Samprapti is also being told. And each Samprapti makes a great significance, and this may be related with many of the other diseases what currently we face. A good example, if you look into the description of Kapaja Pandu, there are many symptoms very closely similar to that of hypothyroidism now, what we clinically see. So, when we correlate a Kapaja Pandu or Pandu into an iron deficiency anemia or etc. and so, we will be restricting ourselves into understanding of our own Pandu concept. So this was not told by me, it was told by Dr. K. Rajagopal in his own article in Vaidyam. He has already told 10-15 years back in many of his articles. So our Samhita's way of understanding a disease entity is completely different what currently we practice, currently we do in a conventional medicine. So we take into this also for differential diagnosis. Like Vadarakta, this is, you are very well known, I don't want to detail about these things, how it has been correlated. Let us come to the last part of the thing. So far Ayurveda is concerned, our Samhitakaras were looking every situation into three categories. One is Hetu, Linga and Aushadha Jnanam. Hetu, Linga, Aushadha Jnanam, Swastadara Parayanam, which is very well known to all of you. So, what is the Hetu, what is the Linga and Aushadha? And for that, history is very important. We ask many questions to a patient, which may be irrelevant to the patient, which may be irrelevant to many other school of thought of people. This picture itself is that. You see the question is. So we may ask many questions to the patient, but we have our own epistemology to say why we are asking this type of question. Not necessary to be judicially be thought why this doctor has asked these type of questions. But we have our own way of asking questions. And most of the time, the Hedu or Nidanas are told in the textbooks are to be converted into questions to the patient. If you ask from a Samhita's period, what is the clinical question to be asked to a patient? Probably our Samhitakaras may say that, what are all Nidana enlisted in this condition? You change the element of this Nidana into a question to a patient relevant to your space and time. That could be the most probable question you may ask. And how a patient is evaluated. It is very significant that whether individual with a disease or a disease of an individual. I hope you understand the difference between both sentence, both part. An individual with a disease or a disease of an individual. Prageva agaram pariksheta. And generalization and standardization. Ayurveda is not a science that creates a standardization system at all. Ayurveda is overruled the standardization and Ayurveda become the customization of the medical system. It has a period for Ayurveda to have a standardization of set of protocols, and Ayurveda overcome that period and reached into a customized system which is very much individualized to that patient. Just like a David Beckham never buy a shoe from a shop, the people will create shoe for him. The company will make shoe for him. But if we go and ask the shoe company to create a shoe for me, definitely they'll kick me off. So, the status of people elevates, it becomes a systemized level to a customized level, and Ayurveda has already overcome many hundreds of years back of systemization and reached into a customized way. I don't know whether Ayurveda community is converted to that status. But generalization to standardization, the least preferred tool so far Ayurveda is concerned. And we follow, especially in South India, we follow Prashna Pariksha should be resorted the most Ayurvedic clinical methodologies. Many people may not be agree with me because in the north of the practice, Nadi Pariksha may be something very important to evaluate a clinical situation, and from some other school of thought they may have another set of evaluation way. Irrespective of the materials, irrespective of the technology or the tools you use, anything, but it should bring some outcome. What a diagnostic is? Diagnosis is an understanding or an attempt to understand. I should say it's not an understanding. Many times it's an attempt to understand in two ways. One, we are retrospectively tracing back ourselves into our own textbook, what we have studied. Another way, we are rolling outward to the back of the history of a patient, in the forward rolling as well as a backward rolling. A backward rolling towards our own samhidas, what has been told, and how it is closely related with this patient time. At the same time, we also roll on to the patient's symptomatologies, and we will try to evaluate what is behind and what is behind and what is behind and so on. And it is an attempt to understand the total procedure of Samtapti and not simply naming a condition. And we try to define the nidanas like nimitta karanas, and mostly what we need from evaluating all these things, we come into a point of, if we able to, come into a point of set of gunas that has been disturbed. Most of the time, it doesn't need to be told like AVP here, because many of the teachers over here are much better than me about speaking about amshamsa kalpanas, gunavikalpam, etc. So I don't want to speak about, but it is one of the best way of getting into subtlety of a clinical understanding. The advantage of those are, it is universally applicable. And besides that, there are also possibility to explore the Roga Marga, assessment of Agni, Koshta, Vayu, etc. This is closely related with the treatment also. For example, when you look into the drugs like Dashamula, it has very less thing to do in the Koshta. It will do so many things in other areas in the body. So if you are selecting a Dashamula, as you know, you never get a good formula like Dashamula Churnam and all. You get Dashamula Arishtam in other yogas. So because basic nature of the Churna itself, that functions perform very well in the Koshta. That is why in the Gulma chapter and all, we'll get large number of Churnas like Shadula Churnam, many things. And in Koshta, Dashamula like Dravya not work very well, or it has much things to do in other part of the body. So the exploring the Roga Marga become very significant whenever we going to choose a drug. Maybe that may be discussed later on. So the assessment of Agni, Koshta, Vayu, and very commonly the chances of Udavartha. This is also very common to whenever we handling with a Vada Vyati. How far there is a reverse movement from Apana to Samana and Vyana, Udana, this type of Viparita or Viparita Gadi of doshas is very significant to be handled along with the disease. See the Vyayama, Nidra, Abhirapanjariya, like things which has been told as many times told as Trayobastamba, Payamas, added as the fourth one by Vaidibhushanam Raghavan Tirumapad sir. He used to say, instead of Trayobastamba, Chadurupastamba. He added Vyayama also. But it is very important to have a clear-cut diagnostic opinion in our own. Otherwise, the patient will make like this. I have already got a diagnosis. So, I like to take a second opinion from you. So, many times what we do that, I think you have a gallbladder problem, but if you insist me to say, there may be a problem of kidney. So, there may be people will come with a difference of opinion. Nowadays, because of the internet and other things, we are fortunate that there are hardly nothing is available about Ayurveda and Ayurvedic diagnosis in internet. So, otherwise, next time will be doctors will change their name into Dr. Google. So, because more patients are going to internet for medical advices. So, coming into our own diagnosis is very much individualized, customized way, never needed to be considered or correlated with another person, because it's his own evolutionary way of understanding his own science and how he utilizes his own knowledge to achieve that result. One of the good example is that a recent article published in November 2010 in the famous journal called Rheumatology, explaining about homeopathy. It states that the evolutionary process of diagnosing a thing is very much important, or have a great role to play even in the result of a medical case. This is, you can see in the website of Rheumatology, famous rated journal, you can see it. So, the evolutionary process of thinking is very important. And what about investigations? Previous speakers has elaborately told about investigations. We are agreeable, Ayurveda community is highly agreeable to any of the investigations because it's a technique of procedure used to accomplish a specific activity or a task. But the problem is that try to make information you get from a modern investigation translate to an Ayurvedic mode. Are we able to translate that information into our own communicable language is a question. And moreover, imaging techniques improves refine and sensory perception, but don't get overwhelmed. Many times this has happened. When we get a diagnostic from a previous doctor, especially from a conventional medicine, we'll stick on to that diagnosis because we believe that he is an aptha. Many times it's not necessary to be. Many times, many investigations become much expensive, and it will become sometime useless, and it may misguide also to us. So, conditions like a PCOS and all, which can be diagnosed directly from a clinical symptomatology, and it is the doctor's duty to hold his own responsibility. I strongly believe that conventional medicine created a system outside his own body so that he followed that system, and they are trying to escape their own individual responsibility, which is completely against to Ayurvedic philosophy. Ayurvedic philosophy strongly recommends that a physician is supposed to hold his personal responsibility in terms of diagnosis, in terms of treatment and everything. So, we can we can use on any systems outside our own thing, but it never dominates us, rather it will be always supporting us, and we should not escape from the responsibility being a physician or a clinician. Just like this, suffering from an arrow of a head, but just to play it safe in order to bunch of test. Or something like this. A patient can undergo a list of investigations. Yeah. And the technology can bring lot of funny things also like this. It's a new medical technology. Instead of crying, we can program your choice into 200 fun ringtones. So, I'll just skip on few things. about Pariksha, because it's already known to you. What I like to say is that so far Ayurveda is concerned, it is a Vaidya's responsibility to understand what a clinical condition is and in which way he follows the system and which way he evolved his own samhidas within him. Still, that is why even today, when I ask my father from last 50 years, he is keep on reading the same Ashtanga Hridaya. I ask him, why you spend a lot of time every day reading the same book? He told, probably Ashtanga Hridaya is not changing, but I believe I am changing every day. So, by this, I hope I made some confusion in you, and probably you may have many questions. I may not have many answers within me. So, questions are always guaranteed in life, but not answers. Anyhow, thank you for patiently hearing me.
Let me start myself with a question. One of the blind person, I'm feeling in one perspective, since Dr. Nambi is right here. While learning, we had always had this thought, doctor, that the Sajati, the Vijati, or the Antarjati Bheda should not be in a Shastra, because Shastra is abadhita. So whether you study Sushruta or Madhav Nidana, the concept and the core portion should be the same without disturbing what is said before. That can be a Shastra. If it's changing, if the views are changing, it will be a science. So Ayurveda being a Shastra and the perception what we have. So how do you relate with this Sajati, Vijati, and Antarjati Bheda should not be there to understand it. So with the Gulma, Paranamshula, with the Sandhigata, Vata, Vatarakta. So how do you answer that?
It's not really so. We have not necessary to stick on like that. For example, if you look the description of Samana Vata Charaka, Dosha Swedambu Vahini Samana Paridishtada, and what is told by Bhagavata, that Samana Agni Samibhasta, Koshte Charavisara. The concept of Samana, what Charaka's period was, completely remodified or re-explained. It was not a contradictory, rather it is explained more understandably in another way. There is no much contradictory, rather re-explained in a different way. So that is a part of the Shastra to have Abhipraya Pheda. They are Abhipraya Pheda, not Viparita to one another.
Sir, I agree with what you have explained about the diagnosis of this rheumatoid arthritis in Ayurveda. It's very difficult. We are already stick on to the research, this laboratory investigation and all the things. We always forget the patient's condition. What is the prakriti? Whether that person's prakriti is associated with the disease or not. Whenever you are taking Amavata, whether Ama Lakshanas are there or not. If Ama Lakshanas are there, then we can change into the Ama Chikisa. If it is not there, then why you want to correlate with the Amavata and other things. It's very difficult to understand Ayurvedic terminology into a modern terminology. When you are talking about if you stick on to the Vata Rakta, if you are diagnosing